We all deserve housing. Yes. We all deserve health care. Yes. We all deserve to live in a country that is not taken over by fascism. Is that right?
Let's start with immigration. We need comprehensive immigration reform.
SNAP benefits are essential for food insecurity, and cutting them off would harm young people a lot. Reduced SNAP benefits can lead to malnutrition among children and teenagers, affecting their physical and cognitive development. Studies have shown that food insecurity is linked to lower academic achievement and increased behavioral problems in schools.
In practice, what we are seeing right now is that because of the economy, the rich people are getting richer, and taxpayers are constantly complaining about where their money is going. Nitro residents are the ones paying the price. Rents are going up, but the conditions aren't. People are being asked to pay more while still living with mold, broken systems, and poorly maintained buildings.
On the richest nation on earth, working people are being told to settle for crumbs. Crumbs instead of living wages. Crumbs instead of affordable housing. Crumbs instead of health care. Crumbs instead of dignity. And we are here to say, no more crumbs. No more crumbs. No more crumbs. No more crumbs.
5 years ago I was homeless, and because of the support, I now live in the Housing Works Supported Housing Program, which has changed my life. And I immigrated to the United States, where I became part of a huge family, a family of people who understood that people's lives came first and profits came second. But if you're cutting the funding, then how would we fund new people getting onto the roads and onto the system and preventing new infections?
It's called the New York Health Act. It would make healthcare free for every single New Yorker. I think that I would rather have healthcare than pay folks overtime to collaborate with ICE to imprison my neighbors.
Policymakers at the federal and state level have the power to strengthen public programs, protect Medicaid, protect Medicare, and expand access.
In 2024, 58% of white adults receive mental health services. But when we take a look at Hispanic adults, that number drops to 44%. For Black adults, it falls to 39%. For Asian adults, it is only 33%. These numbers are not small differences. They represent real people, people who are struggling, people who need support, and people who are not receiving the same access to care.
Paying higher prices for low-quality living conditions, reducing and removing funding just guarantees further neglect. Instead, NYCHA needs stronger oversight and accountability to make sure the money being collected actually goes back into maintaining clean, safe, and livable housing. Funding should be protected and properly managed so residents aren't forced to pay more just to get less.
That's right. Which billionaires get tax breaks and families get benefit cuts? That is not fiscal responsibility. That is greed written into law. No society is free when survival is rationed.